Okay, let's get started then. Good morning. Glad to see you here today. My name is Ed Goodwin. I'm in the House of Representatives for the state of North Carolina from District 1. That's along the coast. I represent 6 counties. With me today is Senator Heiss. I don't know which counties he represents, but it's out west.
Madison, Yancey, Mitchell, McDowell, Rutherford, Polk.
And Senator Jim Bergen, and he's Harnett County.
Harnett, Lee, and part of Johnson.
And Senator Cravick, George Cravick,
Forsyth and Davie.
Forsyth and Davie. I almost have more counties. I think I got more counties than all y'all had together. But anyhow, we're not counting. Called this press conference today to discuss certificate of need laws. There's a lot of things that can come up when we're talking about that. First thing we think about is health care. That means affordable and adequate health care. Then also cost. CON stands for certificate of need, but also the cost of that need. And we'd like to discuss that some too. Briefly, we're looking at ambulatory surgery centers. There's some interest in repealing CON laws completely. Today, we're just trying to take a baby step and just get the conversation started and get the ball rolling and see what we can do with it. Standing behind me today, I don't know how many doctors, I would probably say about 14 or 15 of them are close, maybe so, who are ambulatory surgery center doctors. They know the process that they have to go through to get that certificate of need. North Carolina is one of the states that still has a certificate of need con laws that are active. About half the states in the United States have already eliminated them, and some of them have reduced some of the restriction of them. And there's a lot of data out there that's available for study and to use to help render a decision on what to do about the con laws, repeal them partially or bits at a time, or repeal the whole thing at one time. That's an answer to a question for a later date, and we'll do that when the time comes. Right now, I'd just like to throw you out some figures. While I'm looking at this, I'll tell you, PhD Matt Mitchell from the Mercatus Center, George Washington University, I believe it is, George Mason University, I'm sorry. He will be available to answer some questions as well. He has done a comprehensive study on the impact and the lessons learned from decades of the con laws in the state of North Carolina. He can explain to you how the con laws came into being by the federal government in 1974 and what has happened to us after that. For me, the primary reason I'm here today and the primary reason I got started in this stuff was the cost and free marketplace. I should be able to start any business I would like to start in the state of North Carolina any way I choose if I abide by the local restrictions and guidelines and get a permit to build a building and operate my business. The way full con laws operate, that interferes with the free marketplace, free enterprise. That is not fair. It's amazing to me we're so concerned about healthcare, but yet we ignore the impact of con laws on the healthcare of the people in this state. I will not talk about other states, it's just the state of North Carolina. In my home district, we do not have a single walk-in clinic in 6 counties. We have 2 small hospitals, and those hospitals now we just had one that was closed, started back up. I hope it makes it. But we still have to drive a long way for healthcare because mainly they are holding areas. So everything's under one system. And when you have violation of free market enterprise in the system like we have now, and the people who decide whether or not an applicant gets approval for a certificate of need are the very people that are in competition with these ambulatory surgery doctors. That is not fair. In the state of North Carolina, if we get to a 4-way intersection and McDonald's comes on one of those intersections and Burger King wants to go to the other side intersection, if somebody on that county board of planning and zoning has got interest in that McDonald's, that person has to recuse themselves. But under con law, that person does not have to recuse themselves on that council. And the council in North Carolina is made up of hospital administrators and big hospital doctors. that automatically taints the system and slants it another way. Just to give you a quick example, and then we'll get Senator Berger to come up and talk. I picked this one up today. I had it one time before when I wrote on it, so I'd messed it up, but a good cataract surgeon dropped these off today. In Wake County, a physician-owned Blue Ridge Surgery Center, Blue Options, Blue Advantage, $2,813. Duke University Hospital in Wake County, the cost is $10,613. I hope you kept up with me, the numbers. You can see real quick, that's about an $8,000 difference. Columbus County, non-hospital, Williamson Surgicare, $2,463. Nuvent Brunswick Medical Center, $7,340. Mecklenburg County, physician-owned surgery center, eye surgery and laser center, $1,643. The hospital, $11,871. You see the spread of those numbers. Now, they will magnify when you get to knee surgery, wrist surgery, neck surgery, anything else like that. So we need to start doing something about these con laws, and I don't like to bite off more than I can chew, so I say we start with removing the con laws for ambulatory surgery centers. Senator Burke.
Thank you, Representative Goodwin, and I want to give a thank you to a lot of folks that have been coming by to see me to talk about CON, and especially Senator Provick and Senator Heiss, who have been working on CON and health-related issues, I think, the whole time that they've been up here. Thank you all for what you do. And a big special thank you to Kathy Restrepo, who has come by my office many times to answer questions and to give me some great information. I've been in the insurance business for over 30 years. I served on the hospital board for over 15 years. I served on the SHIC for a number of years. I was county commissioner for 8 years, and I'm passionate about mental health and mental health for the state. So as I got into the CON and saw how it worked, and had a personal experience with CON, when I was on the hospital board, we actually got a CON for a new hospital. And then there was a political decision made to issue a combating but the exact same CON for our county. Over $9 million was spent in legal battles, and not one penny of it went to healthcare. So I'm pretty passionate about CON and what we need to look at and how we need to do things. I worked on a bill that, and I'll just kind of run through the highlights of it because it doesn't do away with CON, but I think it makes some really thoughtful changes that I think could be implemented. So what this bill would do, it would remove ambulatory surgery facilities, operating rooms, gastrointestinal endoscopy rooms, diagnostic centers, kidney disease treatment centers, certain home health agencies, chemical dependency treatment facilities, intermediate care facilities for individuals with intellectual disabilities, and psychiatric hospitals. Basically take everything psychiatric, mental health out of CON. Some of the other things that this bill would do for a new surgery center that would start, there would be a 4% component that would either have to go toward charity care or go as a fee to the local closest Tier 1 or Tier 2 hospital, because they are providing care to anyone that walks through the door through their emergency room. So we need to look at that, and that's intended to keep charity care out in front of us. The fact that ambulatory surgery centers cost on average are about 30% of what a in-hospital charge is pretty significant. But as I've delved into that, and we've got the non-for-profit component that we've got to look at too, and the advantages and disadvantages that both of those have. But as you look at it, somebody that shows up at a surgery center that maybe needs surgery but have a heart condition and diabetes, surgery center's not going to be real keen on taking that on. They're going to suggest they go to a hospital. So there's always going to be those cases, and as we deal with a lot more health cases in especially rural counties, and I'm seeing higher incidence of diabetes, heart disease, a lot of other incidents in rural counties. So that's something that I think we need to take into account. The other thing I saw when I served on the SHIC, that the CON was used as a blocking mechanism many times. And so part of what I want to do is to say that if you appeal a CON, or you challenge a CON by another party, you have to post a $300,000 bond. And it's not meant to stop you from doing it, but to make people think about doing it. And there'll be a $500,000 cap on that. If it turns out that it's a frivolous suit, then there's a mechanism to reward the person that had actually applied for to get the CON. Another thing I think is that CONs ought to have a 2-year shelf life. That if a facility gets a CON, that if they haven't gotten their building design permits and at least turned 1 shovel of dirt, that their CON would expire. And if somebody has an existing CON right now, which there's a number of them sitting out there, that the clock would start when this bill was passed or when it was implemented, that CON would run out. So basically putting a 2-year shelf life and making people think about do they really want a CON and do it. I was told when I first came up here that there was no such thing as a perfect bill, so I know this isn't perfect, but I do think it addresses some things. If we do get this passed, I would like for us to take about a 2-year period to see what happens. A doctor told me one time, you don't give a medication and turn right around and give another medication until you see what the first medication does. And my pharmacist used to say, Jim, the difference between a reaction and a response is a reaction is negative if you give medicine, response is positive. So I want to see what kind of response we get and then kind of evaluate it. So again, I want to thank everybody that's come and talked to me. I still want to talk to others. I've got 2 or 3 appointments today to talk about CON because I think it's a fascinating topic. I think it's something that we can work together to make healthcare much more affordable in North Carolina. And at the end of the day, as a senator and all of our representatives and senators, our goal up here is to make things better for the people in our communities. So be happy to answer any questions. I don't know if Senator Crobbitt or Senator Heiss wants to say anything, but I'd love for them to too.
Senator Heiss?
Thank you all very much. As many of you may know, I've worked on the certificate of need issues in North Carolina for many years now. But I will say that there's probably, having served on SHEC and others, there's probably no area that seems more biased than for ambulatory surgical centers. Not only because what we've really allowed, while there's such complication in going through and trying to get this and others, we've allowed the loophole to allow hospital facilities and others to continue to operate over procedure rooms that they can expand almost with immunity as long as the amount of equipment that they place in the room doesn't meet certain thresholds. And that's why you may even see at certain hospitals and others, a lot of that equipment that's in there happens to be on wheels. Because that doesn't count against the cost of the equipment within the room if it's mobile equipment and others. But there are so many areas in this state that we see where costs can really be dropped by having more competition and more availability within the market. But as you see, as they have information now on particular procedures, having services done in ambulatory surgical centers is one of the greatest cost savings individuals can reach, which would also be cost savings to the state and to the federal government, depending on who the payer is. So that's why we're here for this push again today. Again, I have pushed for the complete eliminations, but I feel really great about this session going forward and the support we're getting. I predict there will be large movements in CON laws during this session that we have right now. And so look forward to all those conversations and be glad to also answer. But Senator Crobbitt will speak as well.
Thank you, Senator Heiss. Thank you, everybody, for being here. And Representative, I'm in the Senate, as you know, and we have a saying over there, the House is different, that they keep talking, even though everything's been said, until everybody says it, they don't adjourn. We don't do that in the Senate, so I'm just gonna echo what my colleagues have said. Thank you all for the work that you've done. I don't see any, we hear all the reasons why we need to have con reform. I haven't seen any reasons why we don't need to have con reform. All the stats that you hear, everything that you hear, and Matthew Mitchell from the Mercatus Center gave us some great information at breakfast this morning. I would hope all of you will go to their website and check out if you have any questions about it, but the data is clear. The statistics are there. And con reform needs to be in North Carolina now. And I thank all these doctors for the work they do.